Take it away, Francine.
Thank you so much. Sorry for. So thank you, Cesar. My name is Francine Umtesi. I'm a biomedical engineer. I work with. I work as the division manager of medical technology within Rwanda Biomedical Center here in Kigali. Next slide. Not sure if the slide is there, but can continue.
There's a little bit of lag time.
So basically,
Francine, try to keep going. Thank you.
All right. So I wanted to first explain what we do at RBC. We are the implementing agency of the Ministry of Health on for different activities related to healthcare services in the country. So we have 14 divisions, former institutions which were put together. Those include, I put a list below, but most importantly, the medical technology handles equipment and infrastructure in the country, and we also support support the policy development for those activities. For COVID, I have to mention that we have also a division called Public Health Surveillance and Emergency Preparedness and Response, and that those are the people who have been at the forefront helping us. If you look at the country's health structure, which really helped in the management of COVID, we have community health workers working at the village level. We have health posts, health centers, district hospitals, provincial hospitals, and referral hospitals at the central, mostly in Kigali and provinces. So this structure helped not only to handle tracing of positive cases, but also handling them and channeling them to the right institutions. Next. As you know, we've had a scare here in the neighboring country, DRC, of Ebola. So starting in 2018, 2019, we had been preparing to accommodate, to isolate Ebola cases in case they arrive. So we had isolation centers built. We had hand washing stations at across borders. So those were prepared for Ebola, but as soon as COVID hit, those centers have been helpful since then. I can say, next slide, please. I can say that in early 2020, when we heard COVID is there in China, it's coming to other countries, Rwanda started its preparedness very, very early. There was a task force, a national joint task force, which was set up. And this task force had a lot of different expertise, different health professionals, different institutions even were engaged to participate so that we can prepare isolation centers, treatment centers. We began towards February, March, we began to procure the necessary equipment and PPEs. So when we got the first case in March, on March 16th, we were a bit more prepared, probably we were a bit better prepared to handle the first cases. So in the preparedness, we also began by improving our national laboratory testing capacity, which allowed us to get to be able to test and confirm the first case in March. This was a very good improvement, and then since March we've been improving and being able to test in all our district hospitals, provincial hospitals, anywhere in the country. When we get a suspicious case, it can be confirmed within hours. Next. About oxygen availability, it is true that we had, our hospitals were not ready to receive COVID cases. Some are still not ready. We have a big gap in oxygen distribution systems installations in the hospitals owned by the government. But in the beginning, we utilized temporary sites, temporary treatment centers, and this was to, first of all, to avoid mixing normal patients to COVID patients, but also because the hospitals were not equipped. So we've begun to install oxygen distribution systems. We have about 43 hospitals that are 45 hospitals that are under either renovation. We have identified wards which we are trying to renovate and install oxygen piping to accommodate these patients with respiratory issues. Next, among some of the equipment that have been procured and distributed in the hospitals, we have ICU beds, ventilators donated by country partners and different donors who we work with. So we've been able to manage the cases. I think you know that our cases are reducing compared to other countries. I believe that we've managed to try and get to the right people in time because of contact tracing, and then we would isolate them quickly and manage to treat them as soon as possible to avoid many deaths. The challenge of oxygen installations, some of the hospitals that we are trying to equip have gotten piping outlets. You can see some manifold installed in Kanyinya, one of the sites where we received the patients starting in March. Others are still being, we are still looking for funding from World Bank, Global Fund, and other donors to be able to pipe and equip in every hospitals. As you know, those temporary sites, we've begun to phase them out, so that the hospitals, instead of having centralized case management, we can implement and we can plan and receive the patients in the hospitals themselves, which will help, even because for now patients have to be transferred from afar to get proper care. So as we decentralize the care, we are empowering the hospitals to be able to receive these critical patients. Next, Another thing that COVID showed us was the lack of if I can say, skills or knowledge from our biomedical technicians when it comes to respiratory care equipment or oxygen supply systems. So we are conducting a lot of trainings, a lot of face-to-face trainings online to be able to help them and learn more how to support the other clinical staff. For what I can say, when COVID began, we didn't have a lot of experienced biomedical technicians. Even our emergency doctors or nurses, they could not really handle the patients, especially those critical patients. So we had a big role to
Francine,
play.
sorry to interrupt. We're already a little bit past your time. Just some concluding remarks, please.
Sure. So basically, we utilize also technology. I want to mention that we utilize technology to manage COVID cases, robots for decontamination. This slide shows numbers as of today, the efforts done, and the numbers show improvement in the management of cases. Lessons learned and the way forward. I think with innovations, interventions, we have been able to prevent and contain the virus so far. Utilizing existing infrastructure helped. Mobilizing all the institutions, including police, military, local government. We have been able to have a good collaboration in terms of managing the cases, but also installations and renovations needed were done quickly. But the pandemic also highlighted a lot of gaps, which we are trying to address, such as capacity building and lack of skills and equipment. So thank you so much for the time. I will answer any question. Thank you.
Thank you very much, Francine. Francine gave us an excellent perspective on how a centralized approach is always very important, especially with dealing with COVID, where normally the pandemic has an asymmetric impact on populations across the world and across different countries.